while you're starting.
Okay, good afternoon. I'm Tracy Walker, the CEO of Journey Found and one of the tri-chairs of the ARPA Advisory Committee. And a committee is a public meeting as defined by the Connecticut Freedom of Information Act and should follow those guidelines. Since we are holding this meeting virtually and it is being recorded, and the recording will be available on the DDS website. Guests are allowed to view but not participate, and we ask that members of the committee make a good faith effort to identify yourself before every time that you speak. And with that, I will ask for a motion to approve the minutes from the June 20th, 2023 meeting.
So moved.
So, Wynn, second? So, okay. All in favor?
Aye.
Any opposed? Okay, the minutes are approved. And Peter, residential transformation.
Yeah, we had our residential committee meeting on Thursday. There was a lot of stuff that we were doing. We were reviewing stuff that had happened. We hadn't been met for a while. And we'll be going over that here. So I'm not going to do it twice.
Okay, great. This is Tracy Walker again. Day, Keith.
Keith Lavalette, DDS. We had some scheduling conflicts and we have not met since the last advisory committee meeting, and our next meeting is not scheduled until July 31st. So don't have a day committee update beyond that.
So, okay, this is Tracy Walker again. Thank you, Keith. DDS engagement. Who is going to be giving that report?
Yeah, we're having the same problem. We've had a couple meetings where we haven't had enough members attend, so we're trying to figure out what's happening with that. So we did not meet this past time.
Okay, thank you, Peter. Tracy Walker again. Individual and family engagement. Greg, is that you?
Yes, that's me. I'm Greg McMahon from DDS. We did meet a week ago, this past Monday. We had reviews from Deloitte, just some updates as well as communication updates from Lauren. But our primary agenda item for the day was to review recommendations the committee had made earlier regarding how to reach out to families. We reviewed their recommendations, reviewed what we've done, what we've accomplished toward those recommendations. We've done quite a bit. Some of the stuff that we were highlighting that we've done is we've produced videos. They're not, I think you've seen one, but most of them are done, with a few coming. I imagine Lauren will touch on that. We put together fact sheets in simple, clear language, updated the website. And the current website and the new website is underway. We've organized YouTube updates with playlists so they're easier to find. Developed newsletters. We're on Facebook and Twitter. There's Fourth Tuesday forums, commissioner forums, fact sheets, training for DDS staff, and educational forums for families, amongst other things. So we've done a lot, which is, not our committee, but DDS as a whole, along with a lot of committee support. The area that we're still struggling with is really how to reach the hard to reach folks, the folks that don't necessarily engage actively in social media, or those folks who don't necessarily look for information. We want to make sure we're not communicating to the same people over and over again and still not reaching out to the hard to reach folks. So there were some ideas thrown around about that, including perhaps setting up a texting, because most people have cell phones, setting up a texting outreach having meetings that we typically hold in offices and community sites and settings, just trying to be more present in the community and reach out to other folks. So that was really the meat of our agenda. We spent most of the time talking about those kind of things and continue to work toward trying to reach the people we can't reach. There's folks that come to every meeting. Those are easy to communicate to, but those who do not are a bit more of a challenge. But it was a very productive conversation, and it was significant that to see what we've actually done, what we're currently have in the pipeline. But there's always more to do.
Tracy Walker again. Thanks, Greg. I think your committee takes the prize for the most engagement over the summer months thus far. Does anybody, before we move along, have any questions for Greg from the committee? Okay, seeing none. Julia, are you doing the presentation today?
Sorry, I was mid-bite. This is Julia from Deloitte.
Julia, can I just interrupt? I have Lauren's got to leave at 2. Could we have her go first and then go on to you?
Absolutely. That's why I had some bites, because I saw your message in the chat. So
Okay, so Lauren.
Hi, everyone. This is Lauren Gray with DDS. Greg gave quite a bit of my updates, but I'm very happy to share a little bit more about what's been going on and what's coming up. So most recently, last week, we sent out our July STEP update. If you are signed up for our e-newsletter, you got an email about fact sheets about the 7 core supports are now available on the STEP website. It also had information on the regional summer virtual office hours. We're encouraging staff, providers, and individuals and families to attend virtual office hours in each region to ask questions about STEP, share comments, or just have a general conversation with regional leadership. All of this information is available on the STEP website here, ct.gov/step. And if you click into each of the 7 core supports, you'll see each of them has a fact sheet in English and in Spanish. They all follow the same format. It has the definition, how it's typically staffed, benefits, potential challenges, and how you can learn more. So again, each of these fact sheets are available for each of the 7 core supports to provide more information and help people, get started learning about each of these. And we also added the regional summer office hours here, so you can see those. And you can always click here for the for Tuesday forums and to sign up for the e-newsletter email updates as well. Any questions about the STEP website or the newsletter?
It's Tracy Walker again. I'm not seeing any.
Okay, great. This is Lauren Gray with DDS. As Greg also mentioned, we updated our YouTube channel. There weren't any playlists previously, but if you're looking for a video, we've added a lot of different playlists. So you can click into these and it does autoplay. Sorry about that. And look at, videos in each of these playlists. It's just categorized a little bit easier so you can find videos a little easier. So I hope that really helps. We are also very active on our Facebook page, Connecticut Department of Developmental Services. I encourage all of you to visit and share as much information as possible. We're also resharing items from different groups and pages, and we're also on Twitter regularly sharing updates as well. And today, we just launched a calendar page. This was feedback from Greg and Shannon's committee to have a one-stop shop for a list of events and activities coming up. So this is now on the homepage of the website under important links down here. You can go to the calendar. and you can see upcoming events and recreational calendars and ARPA meetings and Fourth Tuesday forums for the rest of the year. And this will be regularly updated. There's still a few missing committee meetings on here, and we'll add the rest of the Fourth Tuesday forums on here. And next week is when the commissioners' annual community forums will be announced, and these will be a chance for individuals, families, providers to attend one of 4 updates from the commissioner, mostly using these as a town hall for Q&A. Those will be added and announced here and on the homepage and on our social media next week.
This is Tracy Walker again. Are there any questions or comments for Lauren? Okay, well, thank you, Lauren. So, and now Julia will go back to Deloitte.
Okay, thank you. This is Julia Oak from Deloitte, and I finished my snack, so I'll be chewing on camera. But so going to provide quick couple updates on first on the STEP trainings that we hosted in the month of June, and then some sort of smaller updates around the implementation planning and some of the technical assistance promotion. So to refresh memories, in the month of June, we hosted 3 sets of STEP trainings, a set for providers and a set for GDS staff, each focused on a different topic. So we were really happy with attendance and engagement in the sessions. At a high level for the provider sessions, it varied a little bit, based on the topic. But in the first session, we had 62 attendees, the second session, 71, and the third session, 36. And one of the reasons sort of we believe there's a lower attendance for that third session is it was focused on residential services, and the previous one was on day. So the content was very similar. It was just one was more geared for the day service transitions, day and employment. And for the staff trainings, we had around 100 folks on the first training, 132 on the second training, and about 180 on the third. We don't have as exact attendance information for those since it was hosted on Teams, but overall, we're really happy with engagement. I think especially in a lot of the staff sessions, we're getting a lot of great questions, very specific to folks' roles, which shows that they were thinking, okay, how does this apply to my kind of day to day? And all of the trainings are recorded, and Lauren has been wonderful in helping get those posted. So the provider trainings are all posted on Provider Gateway, and all the staff trainings are on the DDS intranet. So they're available to watch if folks miss or want to go back to any content. And the other piece around sort of a little bit related is I think in our last meeting, we talked a little bit about, TA attendance and starting to promote that. So today we're sending out a survey to everyone who attended the June trainings and then the May info sessions to providers to kind of get a sense for, you attended these sessions, where are you at in your kind of step planning process, just to gather a little bit of more feedback of folks that attended, how they may be in their planning process after attending any of those sessions. And then additionally, we're today also sending out emails to gather some testimonials based on Barry's feedback at our last meeting to, again, sort of get some feedback from providers and be able to, kind of use that to help promote attendance a little bit more. Hopefully get some more folks, submitting plans and moving forward if they're stuck on anything. And then the last update is for implementation planning. That is actively in progress. We, in terms of the step plan that we shared probably a couple of months ago, had a bunch of, big outcomes and then a bunch of sort of action steps associated with those. So DDS leadership has met and assigned folks to oversee the specific action steps. And we're coming down the home stretch of gathering information from all of those folks, which will then input into an implementation plan to really help make a lot of the things in the step plan, reality and kind of come to fruition over the coming months. And that concludes my update. So any questions or things to add, I'm happy to be here to answer questions.
Tracy Walker again. Any questions for Julia? All right, I don't see any. Peter, it looks like we're back to you.
Back to me, huh? Okay, let's see. So, as we mentioned last time, we have 12 plans that have been approved. And we have heard from, I believe it's 3 others that are looking at submitting a plan. We haven't seen that yet. There were a couple others that we knew were looking at submitting during the first phase. So we're anticipating that. So, you know, we are anticipating more providers to be submitting plans. So we'll be looking at forward to that and working with those agencies. One of the things that came through is our Appendix K was approved. And let's see if I can find that. We had sent out a letter to providers regarding that, so I'm going to share my screen. Okay, so this would have gone out to all the providers. And basically it's telling them that what we've been looking forward for a while is our Appendix K was approved. What this does is a couple of things. First off, it now includes an outcome payment for day providers. Before it was just for residential, but now there'll be a day provider outcome for individuals who move from a congregate setting to a non-congregate setting. Any of those 12 providers that have submitted a plan, we're going to be working on revising their allocation amount because now there'll be additional money that they'll be receiving or be potentially receiving based on how well they do on their plans. As part of the Appendix K, we also have set up that there'll be money for agencies that submit and get their plan approved. So we've set aside money for that. We've looked at some outcome payments for specific objectives, and I'm going to go into that a little bit later because it's not as simple as we thought it would be. We have a couple of other things that aren't necessarily tied to the transition plan. So in order to get more providers to do the workforce study or workforce survey from the National Core Indicators, we've got a $2,500 incentive vote outcome payment. And what that does is it's a survey that tells how many staff you work for, how many. Can somebody put their they're on mute, please, because I can hear feedback.
In fact, for our northwestern counties and for Hartford County as well. So we're gonna keep an eye on those storms.
Thank you. So we're looking at trying to get more providers to do the workforce survey. There's one, if providers can get that in now before the end of the year, and we are able to get a month extension. Usually it's due June 30th. We got it till July 31st. So if a provider can get that in before the July 31st date, they would be able to get the incentive this year. And then we'll be also looking to do it for next year as well. 2 other things that we've looked at is also for incentive payments to help providers to get some of their staff certified. One's for employment related certification, and another one is regarding assistive technology certification. We're going to be sending out more information for that. But we're trying to assist the providers to get their staff trained, especially in the area of employment and assistive technology. And I think that's all we had for there, but I did want to bring up something else. Anybody have any questions regarding that piece? That's kind of a high level piece, and we'll be sending out more detailed stuff. If not, let me stop sharing that, and then I want to share. Okay. Can everybody see that?
Yes.
Okay. So the other thing that we did with the Appendix K is also we have some defined objectives. So not only is it for the individuals, an outcome payment for individuals, but there'd also be an outcome payment if a provider meets certain objectives that we've set up. And there's 4 objectives that we've set up. They're not they're all voluntary. It's not mandatory. But if a provider does do that, then there'd be an additional outcome payment for that. One of them is restructuring of a residential setting to support new individuals with specialized or medical specialized or complex medical, behavioral, or clinical needs. So not only will you get a payment for each individual that moves out, but if you have a home that you move people into more independent settings and then bring more individuals who are on our wait list or have unmet residential needs, that we'll be looking at that as helping us move towards supporting individuals with more specialized or complex medical, behavioral, clinical needs. For day program, we're looking at if restructuring a day program to provide new supports that now focus on employment-based services. So if you have individuals in a DSO, and those individuals move into a program that the agency starts. So they haven't had an employment program before. Now they're starting an employment program. That then would meet this objective. Also, if people are looking at restructuring a day program to support individuals with specialized or complex medical needs, we'll be looking at that as well. And then the 4th objective is ending a sub-minimum wage arrangement for individuals. And so if the provider is looking at reducing a significant number of people from currently receiving sub-minimum wage to a more of a minimum wage arrangement, we would then look at that, and that could be considered as an outcome payment. So as I said, we're not just looking at the individual, also looking at the program. And one of the reasons we put these in here regarding the restructuring for the more medical, behavioral, complex individuals is to try to hopefully start addressing some of the concerns that individuals and families had about, well, what's in it for my child who has more significant needs. So one of the things we're trying to do is to incentivize that they would be looking at restructuring their programs to better support these individuals. One of the areas that we're still working through is how this is going to play out with the regions and with providers, and how do we come up with a black and white kind of structure to it. And as with anything we do, I don't know if there is a black and white answer to this, because what may be transformative to a small agency may just be a blip in the flip on the screen for a larger agency. And so we'd have to make sure that we're looking at how this relates to the size of the agency, what supports that they currently have, that they currently provide, what new supports they're providing, and how does that really transform the agency. If a large agency has an off-site program where they do just DSO, and they decide to move all those individuals at that site into an employment setting, we would look at that as meeting this objective. But if they were looking at keeping the DSO and just refilling it with the same type of individual, then we would say that would not meet this objective. They'd still get the incentives for the individuals, but that may not be something that we would consider transformative to the provider. So I just wanted to provide that and see if I have any feedback from everybody in terms of how that looks and what that sounds like, and any suggestions or information you want to share.
Peter, I have a question.
Sure.
It's Wynn Everts from the ARC Connecticut. Can you give us some examples of the line that you just drew about having certain amounts of incentives, but not all of the incentives with respect to the medical or behaviorally complex population?
Yeah, so this one we were looking at programs. So if you had a medium-sized agency and they put in a plan to move 4 individuals from their DSO into employment setting, they already have an employment program, so it's not like they're starting a new program. They would get the incentives for the individuals to move out of the DSO. So those will still be there. They would get the incentive for the outcome payments for the individuals getting into an IHS, employment program. But they really didn't transform their agency. They assisted the individuals, which is great. But they didn't transform that DSO program any way, shape, or all, and they didn't transform their agency by setting up an employment program, because they've already done that. So we're looking at how is this transformative to the provider, and how does that start moving individuals to more individualized community-based settings.
Thank you.
Okay. Michael?
Michael Beloff, parent and agency board member. In considering transformation, one challenge for families as kids move from DSO, where they're receiving 30 hours a week of support, to employment, where they're probably only working 5, 10, 15 hours a week, would the ability to create some kind of socialization program to help fill the hours that the kid would ordinarily now, that the adult is now not engaged for 30 hours a week, they're only engaged 5, 10, 15 hours. Would creating a program to engage those individuals socially be considered transformative enough to satisfy this requirement?
And that's a great question. And that's one of the things that we're trying to look at. How do we be as creative as possible, and how do we assist providers? One of the things, just as an aside, previously we used to, if an individual went from a DSO to an IHS and they got 5 hours of, I keep saying IHS, sorry. Previously they would get the employment rate for the hours that they supported in employment, and that's all they would get. So there was the hours that were missing. Now what we've done is we've allowed people to take their money with them. So now they have that additional dollars. So they may pay for the supports for that 5, 10, 15 hours, but they have other hours, other money left over that then the individual families, providers can figure out to do with. That may be doing a dual program, so some hours in DSO, or GSE, ISE, or maybe it's something like those social clubs that could be set up. I think that's the kind of thing that we're trying not to be prescriptive and say yes or no, because it may depend on what that social club is. Is it just a drop-in center that they don't get any supports, or is it something that's, really assist the individual with employment-related skills, social skills, whatever. So that's why we'd have to see what that would look like for that provider.
And this is Michael again. I think that's great. I think letting parents know that if they go from DSO to ISE, that they're not getting a budget cut and they can reuse that money, I think is something that needs to be stressed to make parents more willing to make that change. Because anytime parents think they're going from more supports to less support, in their mind, that's going from a current budget to a lesser budget.
Right.
So,
right. And
so
that's
having
what we're
that front
trying
and
to,
center would be helpful.
And this is Peter Mason. Yeah, we're trying to get that word out. So that is one of our things that we've been trying to emphasize.
Okay, this is Tracy Walker again. Any further questions or comments for Peter?
Hey, let's see. One of the things that we've been working on is our transformational outcomes and activities. We have established owners for those activities. And so DDS has owners for that activity. Each were supposed to submit how they were going to complete those activities. And one of the things that I know that a couple of the things that they're looking at, they'll be reaching out to providers in terms of having them join them to work on issues such as I think transportation was one of them, and I don't have it off the top of my head. I'll have to look that up. But there are things that we're looking at doing. We're also looking at establishing a training for our DDS licensing, quality assurance, and abuse and neglect liaisons. And the reason we're doing this is we're trying to make sure that we're educating all of DDS on what's happening. What we've done in the past is sometimes in our zeal, we've been so excited to get something out that we kind of left some of the staff behind. Then all of a sudden, when we go to do something, a provider gets hit with an issue regarding licensing or quality or abuse and neglect. So we want to make sure that our liaisons are trained on that. So for example, this is in no way to reduce the amount of scrutiny we'll have on health and safety. But what we want to make sure is that we avoid any of the issues that may come about because, for example, an individual may have, as part of their transition plan, to start to be able to stay at home for an hour. And the providers established assistive technology to make sure that they keep the individual safe, but they're able to monitor the person's activities during that. But the plan, the individual plan didn't get updated. And so quality or goes in, or licensing goes in and looks at saying this person needs 24 hours and there's nobody here. All of a sudden that then creates some issues, and we want to try to avoid that kind of stuff. And once again, we're emphasizing this as not to downplay or to reduce the health and safety oversight. This is more to make sure that if it's part of a plan, that people are aware of that plan, and that the department's behind that plan because it's been approved, and that issues regarding whether the liaison feels the liaison feels the assistive technology is an appropriate support type. Those are questions that should be answered internally first before it gets brought to the provider. So not while we're going to be working on a training for that, we've also designated a point person for these individuals, and that our quality assurance director. And so that person will be able to know what plans are available so that if an issue comes up and the licensing or Q&A or abuse and neglect liaison have a question, they can go to the quality director first and see if that then satisfies the concerns. Or is it really a health and safety issue that needs to be brought forward? So that's one of the things that we're looking at doing. Anybody have any questions on that? Concerns? Right? Let's see. So I am going to see if I can. Where's that letter? I had that up. Oh, here it is. Okay, I'm gonna share my screen again. So hold on. This has just gone out, I believe, today. So where are you? If I can read it, where'd you go? Ah, nuts. I can't find it. Okay, hold on. This one has to do with the room and board. So we have made some changes to room and board. And now I got to just find that letter for us. Where did you go? Okay. Okay. All right, hold on. Sorry, I thought I had it up there. Okay. So this is gone out or has gone out or will go out today. One of the concerns that we had been hearing in the res committee and from providers is, yeah, this is all so well and good, but if an individual can't afford to live on their own, they're not going to move out. And so a lot of that had to do with our current rent subsidy policy. And so we have been working for the last 7 months to revise our policy. The policy itself isn't yet ready, but we know that these are the changes. So these changes will be effective as of August 1st. One of the big things we did is years ago, we used to do base our rent subsidy used to be on the gross earned and unearned income used to be what their share was, used to be 30%. And during a budget option times that we had to lose, had to cut our budget, it had gone up to 45%. So right now we're going to be reducing that back to 30%. So that should allow more income for the individual outside of just the rent subsidy. So in effect, they should be able to get more rent subsidy and use their more of their dollars for cost of their care outside of rent. So we've looked at doing that. We changed the whole thing about what the in-home inspection is. So you'll see that as that comes out. We're looking at the reporting requirements. One of the things that we are allowing at this point, because this was another big concern, was security deposits and how are people going to pay for a security deposit. And so we've established that at this point that that will be an allowable housing cost. And in order to pay for that, what we'll be doing is on the first payment that the individual receives for their rent subsidy, they will be receiving a first and last month's rent. With the goal of that last month rent to be part of the security, would be the security deposit. If at the end the individual goes to move out of their apartment, the idea would be that that security deposit would then pay for the last month's rent. If the individual had a number of breakage and issues regarding the apartment, that would affect their security deposit, they then would go back to Pratt and ask for the difference in order to pay the last month's rent. And so that's the big thing that we did. And I think I saw Michael. Did I see your hand up?
Yes, Michael Beloff, parent and agency board member. I'm assuming that if someone is moving out of an apartment, they're going into a new apartment.
Yep.
And wouldn't they need to be able to reuse that security deposit for the next apartment so that we wouldn't have to use it for last month rent and then request another security deposit, so go through a whole process again to request a new security deposit for the new apartment?
Well, yeah, you would think that as we're going to have to at some point change our waiver so it's a little bit more clear. So in the meantime, we're trying to figure out how to do stuff within our confines. Okay. And the other concern would be they may be going from a to a more expensive security, there would be more expensive lease. So then the rent subsidy would hopefully pay for additional dollars. So that would help elevate the security deposit amount versus us then giving additional money to us. It was going to get awkward. So that's kind of why we did that.
Okay, fair enough.
Anybody else have any questions? No, what a quiet group. Jeez. I hate talking this much. All right, let me finish up with what I got. Okay. We have finally have Rewarding Works. It's our employment network that is up and running. And all of the system is up and running. I know we have tweaks still to go, but it is up and running and it is being used. We're going to be getting our statistics coming up, so I'll be able to share that at the next, at our next meeting, how well we're doing with that. For those who weren't here before, we were talking about the assistive technology request for proposal that we had established, where we would be assigning agencies to assist in terms of assistive technology evaluations, setup of the equipment, purchase of the equipment, training of the staff. And so our very own Katie at STAR was awarded the Fairfield area, Fairfield County area. The other one that was awarded was CIB or CIB, and they were awarded the North and South region. So we're pretty excited about that. Now we'll be working on the implementation or the contract piece of it and hopefully get that up and running. Oh, my hope is in 3 months. We have to go through the Attorney General's office, so that sometimes slows it down. We had the AT conference. I can't remember when we met last time. It was a big success. We had the non-project based supportive housing grants where we had 3 were awarded. We'll be looking at doing an additional non-project based supportive housing grants. That should be coming up, I think, in the fall. Just so those that are for more information, we've been doing supportive housing, and these have been from the ground up. We call those project-based. So it'd be like a new housing complex. The non-project base is those agencies that have, those apartment complexes that are still, have already been built and are up and running. We were trying to see how we can be able to use those facilities, because then we'd be cutting down in terms of the building time. So we have 3 that we're working through. We believe that there's more out there. And one of the positives we've had is that previously our the housing vouchers were only for the project base. We were able now to establish that for the non-project base too. So that's really good. And then lastly, we have hired a project manager and a couple of business analysts for our new case management system that we want to develop and build. Their job right now is going to, we know 5, and I think it's up to 7 states that have a current new case management system. So they're going to be looking at those case management systems to see how they work, what would be useful for DDS. Are there any of those systems that DDS can use? And then purchase those systems so that we can get this up and running. We're trying to avoid starting from scratch because those kind of projects usually take years to develop. So we're trying to see what's else there in the country that we can tap into. The idea for this is that the case management system would be more open and transparent, looking at making it more electronic. So individual plans would be done electronically. The goal is that individuals and families and providers would be able to log into the system and they'd be able to see the individual plans and information regarding their son or daughter, or for a provider to be able to see all the individuals that go to their agency. They would then be able to download the individual plans so that we're not dealing with an individual plan not being available. And for providers also looking at being able to download authorizations so that they would always be able to do in real time what the authorizations are. So that right now is where the goal for this is that we will be looking to get something in the fall, maybe late fall, some kind of recommendation and bring from the manager and business analysts, then bring that forward. The department then makes a decision. We would then go back to CMS and look at a different type of funding that would help to pay up to 90% of the cost. So that's kind of where we're at. So that is my update.
All right, this is Tracy Walker again. Thank you, Peter. Any questions or comments for Peter? All right, Wynn?
Yeah, I'm sorry, I've sort of been in and out of this meeting a little bit. Did any of, I'm sorry, whenever, the ARC of Connecticut and Parent, did any of the people that applied for round 1 of the transformation apply to transform their agency into one that deals with medically or behaviorally complex? Yep.
There are people who in their plans have said, as part of their restructuring, they were looking at moving individuals out and then bringing in individuals who have more medical or behavioral complex needs. So they did say that's part of it, but everything's in the details. So as we go forward, we'll see how that plays out. But that was part of a lot of people's plans, is that when they were going to backfill those vacancies, they were looking at individuals who had more significant needs.
Okay, Thank you for the answer, Peter. I'm sorry if I missed it before.
Nope, that's okay.
Tracy Walker again. Any other questions? Comments for Peter? All right, is there anything else for the good of the order before we announce next meeting and adjourn? So, Michael.
Sorry, Michael Beloff, parent and agency board member. Sorry for keep speaking, but one of the things, back at the end of June, as many of you are aware, House Bill 5001 passed with a large variety of items affecting individuals with intellectual disabilities, including programs through DDS. I don't know how that relates to this committee and transforming DDS services, but certainly things like ABLE accounts no longer being subject to Medicaid payback, certainly, Section 4, where DSS and DDS will recommend new state definitions for intellectually disabled and developmentally disabled, and evaluate the use of IQ in those definitions. Has thought been given as to how the changes made in that bill might impact how this committee functions and what we're recommending going forward? I know it's an open-ended, loaded question.
Yeah, I mean, that bill it's got everything in there in the kitchen sink. So trying to pull that out and try to figure out what DDS has to do, needs to do, all that kind of stuff is still being sorted through. All of it was nice language, but there weren't any, from what I understand, not any dollars attached to it. And so trying to figure out what we can and cannot do and how we're supposed to do some stuff. A lot of it was like committees, a lot of it was studying this. And so trying to look at all that, just from my personal experience, by the time everything washes out, it's probably going to be a year or two before people figures out exactly what it is that was in there. Some of it's pretty simple in terms of language, but in terms of implementation is not. And so how does that all play out? And I don't have the answer, but I don't think it's going to affect us in the short term. And because this is such a defined time period, by the time you really figure it out, most of the providers will probably have submitted plans and we probably have approved those. And so then to go back and tell them to change things or whatever would be very difficult. So it's a long-winded way of saying I'm not too sure, but I don't know if we have enough information to know how this would affect this program.
Fair enough. Thanks.
It's Tracy Walker. And yeah, that was a great question, Michael, actually. Any other questions or comments? All right, the next meeting of this group is scheduled for August 15th. And seeing that no one has any other items to raise, I'll take a motion to adjourn.
So moved.
Peter.
Seconded.
So, okay, Peter and Wynn. I'm assuming no one is going to object to that. So have a great month and we'll see you in August.
Thanks, everybody.